Hi guys, I'm back with another health vlog. And so for this month of October, aside from celebrating Oktoberfest, this is also Breast Cancer Awareness Month. And so I want to use my YouTube channel to share my knowledge and give awareness to my viewers regarding breast cancer. If you don't know, breast cancer has been the leading cancer causing deaths among women globally. And just last year, over 2 million new cases were recorded. And according to World Health Organization, over 600,000 women died of breast cancer. Unfortunately, breast cancer cannot be prevented, but early diagnosis plays a crucial role for breast cancer outcome and survival. So for this video, I'm going to be teaching you how to do self-breast examination, the early signs and symptoms to look for, the risk factors for breast cancer, and mammogram. In front of a mirror, visually inspect your breasts with your arms at your sides. Please take note that when you do this, you should not have any clothes on. Move close enough to the mirror so that you can visually inspect your breasts better. Next, raise your arms high overhead and look for any changes that could be an early sign or symptom of breast cancer, such as changes in the contour, any redness or swelling, any dimpling of the skin, or any changes in the nipple, such as recent nipple inversions. After that, rest your palms on your hips and press firmly to flex your chest muscles. And for some women, the size of their breasts will not exactly match. And again, note for any recent changes both on the breasts while bending forwards and backwards. We move on to palpating both of the breasts, and this is best done when laying down as the breast tissues spreads out evenly along the chest wall. Make sure to place a small pillow under your right shoulder and your right arm behind your head. Using your left hand, move the pads of your fingers around your breast gently in small circular motions, covering the entire breasts and on the armpit. Palpate in a circular motion either from outside to inside like as shown, or you can start from the nipple going out. Next is to squeeze the nipple using light, medium, and firm pressure and check for any discharge. You can also palpate the breast starting from the collarbone, from the middle of the chest wall in an up and down direction until you reach the axilla. Make sure to press the breast tissues on the chest wall and check for consistency, nodules, masses, and tenderness. Do the same on your left breast. You can also do this while in the shower. With soap, your fingers glide more smoothly over your skin. Studies have shown that breast cancer is a combination of different factors. Just being a woman and getting older are already risk factors for breast cancer. Let's just divide the risk factors from the avoidable risk factors and the unavoidable risk factors. Factors that you can change includes being overweight, taking alcohols or smoking, having hormonal replacement therapies or taking oral contraceptive pills, getting pregnant late, or even not breastfeeding is also a risk factor. There are also risk factors that we cannot change or we cannot avoid, like for example, if cancer runs in the family, or if our cells are exposed for a longer amount of time with hormones such as estrogen. So when does this happen? If you have early menarche or early menstruation younger than 12 years old, or you enter late to menopause, like older than 55 years old. Another risk factor also is if you have any history of radiation therapy or radiation exposure. It's best to start self-breast examination when you reach the age of 20. You also go for regular clinical breast examination by a doctor and have a baseline mammogram when you reach 40 years old. But if you are high risk, like for example, your mother or your sister or your daughter is diagnosed with breast cancer, it is advisable that you have clinical breast examination by a doctor every 6 months to 1 year, yearly mammogram starting at the age of 30, and also yearly MRI. Mammography is basically an x-ray of the breast. A lot of women are uncomfortable with the procedure, but it's a good screening test for breast cancer because it can detect any lump or tumor in the breast before you can even feel them. What do we do next if there's a findings in the mammogram? So your doctor will advise you to do other tests like breast ultrasound or MRI, which will give you a clearer, a more detailed picture of the mass or the tumor. And if it turns out to be a solid tumor, then we can do a biopsy so that we can confirm the diagnosis if you have a breast cancer or not. For my final advice, please familiarize yourselves with your own breast so that when you see any or recent changes or abnormalities, go to your doctor so that you will be evaluated properly. So that ends this video. I hope you've learned from this, and don't forget to share it to your friends and family. Till next time, bye bye. Mwah.